Hello everyone. Today's interesting topic is rectus capitis posterior major. It is one of the muscle of the neck. So this is that muscle, rectus capitis posterior major. Welcome to Logic Medico. If you are new to my channel, consider subscribing and press the bell button to get the latest notification of the videos. Rectus capitis posterior major location. It is on the posterior surface of the neck. So what is the meaning of this rectus capitis posterior major? So rectus means straight, okay. Capitis means it's going to the skull cap. Posterior means from behind. Major means out of the two parallel muscles which are straight, one is big and one is small. The bigger one is called major and the smaller one will be called as minor. So rectus capitis posterior major is a muscle which is straight on the posterior surface of the skull cap and it is big. That is the meaning of the muscle rectus capitis posterior major. Location, just now I told, posterior surface of the neck. The muscles of the suboccipital triangle are the following. Rectus capitis posterior major. This is today's topic. Suboccipital triangle is a triangular area which is present not only behind the occipital bone but also underneath that. That's why it's called suboccipital, like a submarine will be underneath the water, it will go like that. So this is a major muscle in that rectus capitis posterior major. The tinier one will be called as rectus capitis posterior minor. What is this muscle which is neither straight, neither vertical nor horizontal? It will be called as oblique. Out of these two, okay, if you told oblique, it's correct answer. Out of these two, what is this oblique when compared to this? If you told superior, then you told the correct answer. So this is superior oblique, also called as obliquus capitis superioris. And this one opposite of superior, which is lower down, inferior oblique or obliquus capitis inferioris. You can see my videos based on these two oblique muscles which are already there, okay. So rectus capitis posterior major. The origin of this muscle can be better understood by knowing these landmarks. So what are these landmarks? This is an occipital bone of the skull, okay. This is the first cervical vertebra, atlas. This is the posterior tubercle of the atlas. This is a transverse process of atlas. This is the posterior arch of atlas, okay. This one, this is the spine of axis, the second cervical vertebra. So here there will be two muscles, okay. One is longer, bigger, straighter, okay. The other one is tinier. So this major is coming from where? It's bigger, okay. It's coming from, if you told axis, then you told the correct answer. Where is the rectus capitis posterior minor coming from? Atlas, because it is minor. So by this logic you can make out from where the rectus capitis posterior major can arise from. Because it is longer and bigger, it should come from axis. So the origin is from the spine of the axis. As it goes upwards, it's going not only upwards but also slightly laterally. So it is getting attached to this bone, that is called insertion. This bone name is occipital bone. Here we have the superior nuchal line, inferior nuchal line. So it is getting attached below the inferior nuchal line to this part of the occipital bone. That is an insertion. I repeat, it begins from the spine of the axis, runs upwards and slightly laterally to get attached to the occipital bone below the inferior nuchal line. That's good enough, okay. Come to the action. It is mainly a postural muscle. It maintains the erect posture of the individual. But when this rectus capitis posterior major of one side acts with the other side, when both of them act, it will pull the skull backwards. So when it pulls the skull backwards, that's called extension of the neck or the head, you can tell, extension of the head and neck, in which your chin will point upwards, okay. Chin will go upwards. When this pulls it from behind, chin will go up, okay. That is called extension of the neck. But when it pulls on only one side, it will twist the skull toward the same side, so the chin will point towards the same side. I repeat one more time the action. When both the rectus capitis posterior major of the right side and left side works, it will extend the head and neck. When only one side will act, then it will rotate the skull in such a way the chin points towards the same side. I hope you got these actions. Nerve supply. All the muscles of the suboccipital triangle are supplied by this nerve which is there in the suboccipital triangle, so we call it as suboccipital nerve. But from where exactly this nerve is coming from? It's coming from spinal cord. Which level of spinal cord? The first level of the spinal cord. So it is a dorsal rami of the first cervical spinal nerve. That is the nerve supply of this. So that is a suboccipital nerve or dorsal rami of C1. In summary, rectus capitis posterior major. It is one of the muscle of the suboccipital triangle, location, posterior aspect of the neck, origin from the spine of the axis. It runs upwards and laterally to get insertion to the occipital bone, where just below the inferior nuchal line. What is the action? It mainly maintains the posture of the head and neck. Acting together, it causes extension of the head and neck. Acting alone, it will twist the skull so that the chin points towards the same side. Nerve supply, suboccipital nerve or the dorsal rami of C1 is supplying the rectus capitis posterior major. So this is a summary of rectus capitis posterior major, meaning a straight muscle on the back of the neck which is going to the skull cap and it is big or large. So rectus capitis posterior major. I hope you like this video. Share this video with your other friends so that let them also learn. Press the thumbs up button and consider subscribing to my channel and press the bell button to get the latest notification of the videos which I upload. Recommend to your friends as well. Thank you for watching this video.